Want to say good morning to all the listeners of DBS Radio and Kyrie FM. Thanks for joining us for this morning's COVID-19 health discussion. Of course, this is an opportunity to present some credible, factual information to the general public. And of course, we will be giving the general public an opportunity to ask their questions. I will be your host for this program, Sheena Harry. And joining me this morning is the Chief Medical Officer with the Ministry of Health, Wellness and New Health Investment, Dr. David Johnson, and also the National Epidemiologist, Dr. Shaluddin Ahmed. Good morning, gentlemen.
Good morning.
Good morning. Good morning,
All right.
Miss.
Gentlemen, good morning again, and thank you for joining us. Thank you for taking the time off, because we know that now is an extremely hectic time for the ministry. But we appreciate you taking the time off to appease the fears, more or less, of the public, and to also present educational information, because we know there's a lot circulating. Everybody's being bombarded with information. But thanks to you and what you know, we're hoping that now they can be presented with all the information they need, factual information that they can share. Dr. Johnson, an opening statement from you. Tell us about the ministry and how you've been monitoring the situation as it comes to COVID-19.
Thank you very much, and it's a pleasure to be here. And let me say good morning to everyone, those in Radio Land, those who might be joining in live on Facebook page, as I understand it. So you asked a very broad opening question in terms of how we have been monitoring. So I'll start from the beginning, to use a redundancy. Let me say, for anything that is going on in any country, any part in the world, there's a system in which the Ministry of Health is informed. So all countries under what we refer to as the International Health Regulation has an obligation to report any public health event of interest, of concern in that country, to the World Health Organization. So we have that structure in Dominica. We have what you call international health regulation focal points. Whenever anything's happening in the country, both the national epidemiologist and myself, as CMO, were informed instantly of that through a secured email by WHO. So, for instance, since this incident began happening in China, in terms of the cluster of cases of pneumonia of unknown origin, the health authorities in China informed WHO, and WHO now has an obligation to inform all countries for a secured email, informing them what the country has indicated. So we were informed. We have a system in Dominica in which we have what we call a national public and surveillance team. We meet regularly on a Tuesday. So we actually, and that system has been in place for a very long time, I would say since 2003. We alerted all of our healthcare workers very early in January, the first week in January, in terms of what was happening, and decided to activate what we refer to as our pandemic influenza plan. And we can speak to details as to how that goes on from there in terms of all of the activities that the Ministry of Health has been doing. So this is how it works. What we do in the Ministry of Health is guided, and what we do in Dominica is guided by the recommendations coming out from two agencies, basically WHO, Pan American Health Organization, and the WHO, and also the CAFA, the Caribbean Public Health Institute agency that is based in Trinidad. So initially, I will start by indicating exactly that's the sort of mechanism that we use, and we can speak in details in terms of what our plans are. But more importantly, I wish we could spend a significant amount of time hearing some of the concerns from the general public. We would like to educate the general public, share information with the general public as to how they can protect themselves. We know that there is tremendous amount of fear and anxiety because it's a new virus. It's all around us. And persons are legitimately concerned, and that's why we are here, to tell them how to protect themselves, tell them what is happening in terms of our institutional preparedness. Thank you very much.
All right, thank you, Dr. Johnson. Of course, like Dr. Johnson said, the public will be given a chance to call in and, air their concerns, and we'll do that after this little session, this educational session to the public. And the number to call, of course, is 448-3284. So just give the guests a chance, and then after that, we'll open up the lines for questions and comments. Now, let's get down to the nitty-gritty. The first question, the first burning question that everybody has and everybody has been asking is, do we have any confirmed cases of COVID-19 here in Dominica? So many rumors. We've heard a lot. We're bombarded, as usual, on social media with cases here, cases there. Tell us, what is the situation in Dominica?
Okay, so I will answer that, and I'm going to then turn over to the national epidemiologist to give you details as to how we do things. And so, off the bat, I will say to you, we do not have any reported confirmed cases of COVID-19 in Dominica. As I speak now, March 18th at 11:12 a.m. Eastern Caribbean Standard Time. We will go into details as to how we do testing. We have the capacity for testing in Dominica. We have done testing in Dominica, and details in terms of how we go about testing individuals. So I repeat, we do not have any confirmed case of COVID-19 in Dominica as I speak now. We have the capacity to test. We have been testing. We have not found any positive case. We are not saying absolutely that we have not tested 70,000 Dominicans, and we'll speak as to what is the algorithm for testing, because there's a lot of concerns in terms of who get tested and whether COVID is in fact in Dominica. But what we are saying, from the information that we have, from the tests that we have done, we have not identified any positive case of COVID-19 in Dominica as of 11:13 a.m. March 18th, 2020. And Dr. Hamid could speak in terms of details as to our testing mechanism or algorithm.
Okay, thank you, Dr. Johnson. So you just heard, as of this moment, we have no confirmed cases here in Dominica of COVID-19. Now that that's cleared out of the way, Dr. Hamid, to you, tell the public a little bit more about COVID-19. Give us a little background for those who are not aware yet of what this virus is, and why is it causing such a panic around the world?
Okay, good morning to our audiences. Thank you, Miss Sheena Hari. Before I start with my data and numbers, I just want to mention that I have been with this Ministry of Health for last 13 years, working as communicable disease surveillance officer initially, and now I'm as acting epidemiologist. And it's been longest while I'm in this same business that I'm doing it now. And just to add to it, since I joined the Ministry of Health as this surveillance officer in 2007, in the same year, at the end of that same year, the CAREC actually rewarded Dominica as one of those pioneer in surveillance. Not only that, 2 years later, we also were rewarded and uploaded for our work in surveillance, and in 2010, and subsequent to 2013 also we were joined first in the Caribbean. Now the CAREC, now is CARFA, is actually the CARICOM body for epidemiology unit. They monitor the diseases for all kinds of diseases, chronic and non-communicable diseases, as well as the mortality. So they are the main center for all CARICOM countries. So they recognize that Dominica is a pioneer in terms of our model country in the Caribbean in terms of surveillance when it comes to surveillance. Now let's get to some of those data that we have. We had gone through many outbreaks, and we experienced, we managed, we mitigated. In 2009, we had H1N1 outbreak. We successfully controlled that outbreak and minimized the casualty. We successfully controlled chikungunya outbreak. We successfully controlled our Zika outbreak. We successfully controlled even post-Hurricane Maria outbreak. So we do have some baseline, um, to say, guidelines. We do have the baseline guidelines and protocols in place in order to start our work for coronavirus or this COVID-19 virus. So from that, we take the lessons, we tweaked our information, and given information coming from our World Health Organization and Pan American Health Organization, we are prepared in all sectors to contain this spread of this coronavirus. We have areas of ports of entry, we have areas of hospital case management, we have areas of isolation unit, we have areas of lab, we have areas of surveillance. All these protocol and guidelines are looked at, and we are actually updating as we go along. So let's get to the coronavirus. I came here today with the back-to-back event that we had in 2019 dengue outbreak. Now we are actually facing a probable COVID outbreak, but we are here and we are prepared. In globally, coronavirus, we have over 200,000 now confirmed cases of coronavirus. Of them, over 8,000 deaths. The coronavirus actually, most of them, 80% of the cases thus far presented with mild symptoms. 80%, mainly with flu-like symptoms. Initially, fever and cough, and 14% actually developed to severe form. Those who had underlying condition or comorbid condition, and also who had advanced age, they presented with a severe form of symptoms, and that includes shortness of breath or pneumonia, signs of pneumonia in chest radiograph. And 5% developed into critical. They require severe management in intensive care unit. Those critical patients may develop respiratory failure, septic shock, and other complications due to this coronavirus. Thus far, WHO announced the mortality of this coronavirus is 3.4%. So this is just the summary of what is going on globally. And we are all aware of the countries in the Caribbean that involved in coronavirus.
So one of the things I would like to add in terms of what Dr. Ahmed indicated, basically how our system works and what we have been doing for many years. And he highlighted a very important point, which is we have been able to successfully manage outbreaks in the past. This is a new virus. We don't know how it is going to play out in the Caribbean and in Dominica. We have a system in place, but one of the things I would love to see at this point is that to be able to successfully manage any outbreak like a communicable disease as this virus is the participation of the general public. And that's why we are here, because all of the times that Dominica was able to successfully manage any outbreak, it was because of the public education, and I have a lot of confidence in the Dominican citizen. I have a lot of confidence in what is going on in terms of the leadership and the all of society approach that the government is using to ensure that we are prepared as best as we can. Granted, our preparedness will be determined by when the rubber hits the road, as they say. We put our system in place. We are preparing for the inevitable, and we like to hear from the public and share with the public as well what are some of the preparedness methods that we're using. But before we go into any further detail, our preparedness is guided, as I said, by what the WHO and World Health has put out there. And CAFA, obviously, it is based on what is known about this disease. We do know that it is spread by large respiratory droplets, and direct or indirect contact with infected secretions. So if you get in contact with infected secretion by someone who is coughing and sneezing of the virus, we know that the incubation period of the virus is between 2 to 14 days. We know that there is some indication, at least it is being studied, and we don't want to go into details of that, but persons obviously are researching it as well. A lot of scientific research going around this new coronavirus, that there's some indication that it might be spreading, or it can spread through body fluids like blood, sweat, saliva, sputum, nasal secretion, vomitus, urine. But what is happening now in terms of the mass outbreak and transmission is not through that method. We also know that it is said, and there's some indication that some persons who are asymptomatic might be transmitting it, but it doesn't appear that that is the main form of transmission. And we also know that that it is not spread through water, mosquito, or food. So what we're doing in terms of our preparedness is guided by the science in terms of how it is spread. Thank you.
All right. So, Dr. Johnson, I'm glad that you touched on preparedness, because that's one of the concerns that we're hearing from the general public. How prepared are we? How prepared are the ports of entry? How prepared is the hospital and the other districts for if there is, God forbid, an outbreak of coronavirus in Dominica?
Good. Thanks for that question. As I said, the preparedness will depend on what we do, not only from the Ministry of Health, but what is done nationally. We'll speak in terms of what is done from the Ministry of Health, but preparedness in anything that involves a potential national disaster, well, this through a public health event like Corona, would involve not only what the Ministry of Health can do, but what each and every single individual, man, woman, and child living in Dominica is going to do to allow us to prepare. So it takes preparedness come from what is happening in the public by each individual to what is going on right up at the policy level. But at this time, we'll not be discussing in terms of the policy level. So that is the preparedness that we're talking about. So I don't want persons to think that when you talk about preparedness, it's only what the Minister of Health has to do. And I've been listening to a lot of programs and very interested in terms of what other institutions are doing in terms of their preparedness, their business continuity plan. God forbid that we have massive community outbreaks. All of that involves our preparedness. To go back to your specific question, as I said, what we're doing guided by what WHO and Pan American puts out there. So we have developed protocols in terms of at our port of entry, and we can speak to details in that we have in terms of put up a system where we actually screening at the port of entry. We have our public health, actually our port health officers who are there. I must say that what we have is a system where on any conveyance, let us suppose an aircraft or ship, or one of the cruise line, or even through a ferry, they are obligated to send in advance to the Ministry of Health what we call the medical declaration of health. So we get that. We look at it. And see exactly what is happening on board. We get the names of every single passenger who is on board, every single crew member who is on board, and there's a report in terms of the health status. We get that 24 hours in advance, and we also request it 4 hours before any ship were to land. It also happens in terms of an aircraft. If an aircraft is coming into Dominica, we get in advance a medical declaration of health. And based on that information, then we take necessary steps in terms of protecting the passengers who are coming off from the plane or from the cruise ship, or even make a determination as to whether any cruise would be allowed to dock in Dominica or not, what we refer to as given practice. So when passengers leave any port of entry, now we actually do some screening through thermometers. We have a checklist in terms of where we interrogate those individuals by the port of officers. Depending on the information that we get in advance, or depending on what we find at the port of entry, based on the question that is done. And I must say, it is done. All of this is done in collaboration with the Immigration Department, with the Customs and Excise Department, with the port of officers and our medical team. And based on the information that we gather from the medical declaration that is provided to us, from the on-site screening that is done, then we manage accordingly. So, for instance, if we find that someone is coming from, is considered to be a high-risk passenger, the system we have in place now is that we allow, we speak to those individuals, and if they're locals, local quarantine is provided for. In other words, someone coming in and they might be having considered to be a high-risk passenger, a local, we actually, the information is channeled by the port of officer to the chief environmental officer, to the national epidemiologist. It comes up to the chief medical officer. Depending on the concern, it goes to the discussions also held in the minister in terms of what is happening, and these individuals are quarantined at their homes. We have and what we refer to as the medical teams in all of the districts who are following up these individuals. We follow them up physically in terms of visiting their homes, see how they're doing during the quarantine period to find out whether they're asymptomatic. We also advise them to report to us. There's a hotline that we have, 448-2151. We have the telephone numbers. We follow up these individuals. So that is part of what we are doing in terms of persons who are entering from high risk countries, where we follow and monitor them. If they show any signs and symptoms, then we immediately would test them, and there's a facility at the hospital where there's an isolation unit. There's an isolation unit at the Princess Margaret Hospital, where we make arrangement for patients who are would be admitted, and in the event that we have any severe cases, we have the capacity, at least now as I speak, to treat in the intensive care unit, at least at the Princess Margaret Hospital. Dr. Ahmed obviously can go into some more details in terms of some of the other things that we are doing in terms of our general surveillance and preparedness.
Okay. Just to add to Dr. Johnson, we have surveillance, a general surveillance for all communicable diseases, including emerging infectious diseases, exists since 1993. At that time, it was mostly sentinel surveillance, but in 2010, actually, we rolled out to all health districts. So the surveillance now exists in every corner of Dominica. And every corner of Dominica where there is a primary care service, there is surveillance. So that brings up all our 49 health centers into the focus of this surveillance. So the all sites is a reporting site for us. We have one general hospital. There are many medical wards also part of this surveillance site. We have one accident and emergency department, also surveillance site. At the Portsmouth Hospital is a surveillance site. We have public lab is our actually surveillance site. So surveillance in terms of the infrastructure is widespread, and as robust as our primary care is, our surveillance also with that degree of robust. The acute respiratory illness surveillance, which is a coronavirus, a component of, in terms of its clinical presentation, exists since 2007. We have called SARI surveillance, severe acute respiratory illness. That is to monitor a patient who comes to our health facility with flu-like illness, and if they are severe enough to require hospitalization, then we monitor the patient all through, from the day patient got admitted to the day patient was discharged, and what was the pathogen, all that includes in it. And then we review those cases on weekly basis at our National Public Health Surveillance and Response team meeting every Tuesday. We follow the trend. We look into what is circulating in the community. Based on that, we also provide information for purchasing our vaccine, and that vaccine program is in place for influenza-like vaccine. So in general, that's the basis of the surveillance, and that's where we actually that's the foundation of surveillance today for this coronavirus. We have upgraded some of those information that we need to collect for this new virus. Hope it doesn't come our way, but nonetheless, we are prepared in every aspect of this surveillance for this coronavirus. So as Dr. Johnson mentioned, the port health surveillance exists. There is a written protocol exists. There is an algorithm exists. How and when, what type of passenger we should be checking. We have the protocol for asymptomatic passenger. We have protocol for symptomatic passenger, and then protocol all the way from the time a pilot notified a case to the point the patient is, for symptomatic cases, transferred to the hospital. All protocols are in place in terms of ports of entry. As I speak, the hospital already finalized their plan as when they receive the case at the hospital, who and when and how that patient should be managed and where patient should be checked in. So there are more to it. I'll come back to it as time goes. Thank you.
Yeah. So,
Dr. Johnson, you were going to say something?
yeah. I wish we could get into to really telling the public some of the things that they really need to do, because as I said, it is absolutely critical that in this fight against the COVID, that the public is involved, the public is educated, the public knows exactly what they need to do to protect themselves. So we can't repeat that enough, and I really want us to get into that, because there's a lot of misinformation out there, and they seem to be coming from credible source, and they're not coming from credible source. I saw one over the weekend, and the national epidemiologist and myself were discussing it, where persons profess to be some very good doctors overseas or wherever they are, and talking about blowing hot air up your nostrils to kill the virus. I mean, what we and the public see these things, and they will say, okay, look, this is a doctor. He says he's a doctor. We haven't seen the face, but he says he's a doctor. He's some virologist, and then we promoting things that are not scientifically proven. So what we do in terms of prevention, and the public needs to know, is what comes from reliable sources. And the public can go to those sources as well. I mean, everybody has an internet, has a smartphone. You can go to those sites and find out what you need to know, or what you need to do to protect yourself. You can go to the WHO website. You can click on the CAFO website. You can click onto the CDC, that is the Center for Disease Control, based in Atlanta website. You can click onto the Pan American website. So when these fictitious stories come out there about the use of garlic or hot water or gargling your throat to kill the virus, or persons demonstrating or professing that they're very intelligent virologists out there, that WHO has not yet sanctioned it to be using, and I saw demonstrating that this what you use, the air blower. And some mist from a bottle, blowing it up your nose to kill the virus if it gets into your nose. I mean, there's no science behind that. And where the temperature could reach 153 degrees, you'll burn yourself. You'll burn your nose. You'll suffer from all other things before you actually get coronavirus. So we just want to encourage the public to seek information from credible sources and not from the social media and these things that are going outside there by persons who are professing to be doctors, virologists, and they are not sanctioned by WHO.
All right. Dr. Johnson, thank you very much. Of course, we want to thank the listeners once again for tuning in, and you will have your opportunity to call in shortly. Now that you've spoken about the preventative measures for the general public, let's get into specifics about that. Let's speak of the signs and symptoms, and also what can people do to protect themselves against not just coronavirus, but we're also in the flu season, and there is a strain of H1N1 going around. So, what can the general public do to protect themselves?
Okay, good. So I'm going to start, and Dr. Ahmed, the national epidemiologist, will jump in. He will continue. So as we said, to protect yourself, you must know how the disease is transmitted. Okay, we have already discussed that. It is transmitted usually through cough or sneezing, or if you if a surface get infected by these droplet and you touch that surface with your hand and you touch your nose, your eyes, particularly your nose and eyes, then you can infect yourself. So to be infected, you have to have some sort of exposure. To the best of our knowledge, what we know for now is the virus is not just flying out in the air all over the place. To say that the wind is, I'm sitting here and it will fly from Roseau down to Canefield by some wind that is blowing it all over the place, or some mosquito that's going to bite me and then bite you. Okay, so that's not really spread. You have to be in some sort of close contact and get infected that way. So having said that, there are 5 measures that we are promoting with the general public to protect themselves. To avoid exposure. And we speak about hygiene in terms of hand washing. And one of the things that we are doing, and I wish that we could have circulated and person actually see the demonstration how to wash your hand, because there's a proper way to wash your hand. It's not just wetting your hand with soap and water and washing it off that's going to protect you. And there's a way in which you wash your hand. But we advise persons that to wash your hands, and particularly after you cough and sneeze. And it's interesting, we talk about cough and sneezing and washing your hands on contaminated surface. Let me give you an example. So changing behaviors could be difficult. So I saw recently, for instance, persons playing domino on the domino table. And actually, a gentleman is actually coughing his hand. I told him, okay, you should not be coughing in your hand. You need to cough in your flex elbow. And the same hand that he coughed in, he actually used it to shuffle the domino around the table. Shuffle the domino around the table. Shuffle the domino around the table, and all of the 3 other men sitting on the table touched the same domino. They didn't shake his hand, but at the same time, they are touching the domino that most likely got infected by whatever virus he spilled out there in his hand. And therefore they began touching the nose and the mouth. And you see how easily it can be spread. I mean, that's a practical example, right? So we advise individuals, okay, do not cough in your hand. It's a difficult thing to do for those of us who have been used to it for many, many years, but you have to practice it in terms of coughing in your flex elbow. So wash your hands. After you sneeze, or do not sneeze in your hands, but make sure you wash your hands regularly for 20 minutes with soap and running water. After you use the bathroom, so you go to the bathroom and you wash your hands, but then in leaving the bathroom, particularly if it's a public place or a business place, then several persons might be touching the doorknob. And therefore, we advise that if you're going to wash your hands, it is clean, and you're leaving the bathroom, you should not be touching the doorknob. And we hope that we have those doors. Well, it would be ideal if you have those doors in the public places and the business places where you could just push them with your shoulder and move out. But if there are knobs where you have to turn, then you use a clean tissue to actually turn the knob and open the door. Because it wouldn't make sense you wash your hands and then you get infected by touching the doorknob. So during preparing a meal as well, you should wash your hands. After caring for the sick, you should also wash your hand. If you're playing with pets, you should wash your hands after that. You go to dispose garbage, make sure you wash your hands. Obviously, if your hand is visible dirty, wash your hand. Playing outside, wash your hands. I spoke about in terms of cough etiquette. it sounds very simple thing, but it is an important way of preventing yourself from getting from transmitting the disease or getting the disease or any virus, particularly as it relates to COVID. We are now telling the general public that avoid handshaking. I just gave you the incident. Person's coughing in the hand, your friend, you don't see him, but there's your friend, he coughed in his hand or her hand, he or she comes and shake your hand. And then you take that hand and wipe your nose and touch your face or your nose. One of the things that we also want to encourage is the actual cleaning of surfaces like doorknobs and those things where persons, your computers, things that you're touching up with your hands, your cell phone. Interestingly enough, the cell phone, all of us have cell phones. Some persons have 2 free cell phones. So you wash your hands, your cell phone is there, you give it to your friend to make a call, and it is infected, and therefore you take that cell phone and put it on your face, you can infect yourself. So you have to ensure that you clean your cell phones as well. And for surfaces like doorknobs, etc., and your desk, we encourage that you clean these surfaces. We know that there's a rush for things like bleach now. What is being advised is that you use 5 tablespoons of bleach in 1 gallon of water, and that can be used to disinfect particularly hard surfaces. So I'll stop there for now, and obviously the last thing I would love to say is, before I allow Dr. or National Epidemiologist to jump in, is rest is important. I mean, your body needs to revitalize, so you need to rest so that your body could revitalize. So resting and getting enough sleep is absolutely very, very important. I also just want to mention one thing as well, and we'll speak to it in details in terms of what are some of the plans that particularly our persons who are suffering from what we call comorbid conditions like hypertension and diabetics and cancers must do. But again, I said I really want to be able to speak to questions from the general public to hear what are the concerns are. Thank you.
Dr. Ahmed?
Yes, thank you. I just want to go back to Dr. Johnson's point of hand washing. We cannot talk enough about hand washing. I just want to focus or take you the rationale behind the hand washing. Just little more scientific information I want to give it to the people. In terms of the COVID-19 virus, it lasts on the surface. So the details of it, that it lasts in a cardboard surface 24 hours. On the plastic surface and stainless steel surface, it lasts up to 2 to 3 days. 2 to 3 days. When you talk about playing dominoes and someone is sneezing within that perimeter, which is within close distance of 5 to 6 feet, right? Hear me out. Post aerosolization, after cough and sneeze, that virus can survive up to 3 hours. Now, someone is sneezing on the table, you're sitting next to someone, it can survive up to 3 hours. So those who are playing dominoes, and if they are close proximity to that aerosolized COVID virus, they will be easily get infected. So when you ask the public to maintain the respiratory etiquette, so now you know the importance of it, that you do not sneeze in the ear, sneeze where you are prescribed to sneeze, in your elbow, bending your elbow and sneeze in it, because it will not just go away within few minutes or seconds or even hour. It takes 3 hours to clear entire the airspace. So this is very important in terms of maintaining respiratory etiquette. Also, I want to say social distancing. I mean, if you don't need necessarily to be in a mass gathering or in a gathering to say. For example, stay late in the rum shop or stay late with the Domino's. Please stay away from those type of thing at least next 3 months. This is very important. This is important because not only for your life, for your family life, and for the country's, the people's life. Also, there is implication to the burden that we are about to face. We are trying to minimize and maximize our effort and minimize the casualty. So this is important that what we say, please listen carefully and try to accept. And this is scientific data we are providing you. No rumor, nothing here. I want to make another point too, that is that people with chronic condition and people elderly, if you guys feel any sickness, any mild flu-like illness, please inform your doctor, your nurse, your healthcare facility where they is. Just give them a call and let them know, inform them that how you're feeling. That's very important for us to monitor you very closely. As we know, we are trying to, the elderly folks, we are trying to actually bring them or make more attention to those that high risk groups. So this is very important. Another thing I want to share with you, that in China at the beginning of the outbreak, there were actually few individuals with coronavirus, only few. The rest had actually normal flu-like illness. So it happened that they were afraid so much, they rushed to the hospital with their even healthy states because they thought it was coronavirus, they are getting it. They rushed to the hospital. Inadvertently, actually, they contracted the virus from the hospital and bring to the community. That was the main reason to lock down the entire Wuhan city. So I want to ask you, those who are healthy individuals, do not rush to the hospital just because you feel mild flu-like illness. Please call your doctors and nurses, and then they will assist you how much attention you need and where you need to go and what you should do.
All right, Dr. Ahmed, thank you very much for all of that insight. I know the public and the listeners have some burning questions that they would like to ask our panelists, so let's go to the phone lines. Good morning. Thank you for tuning in.
Good morning.
All right, go ahead and present your question.
No, Dr. Johnson, I mean, after this, how is the handling of the dead now? Say the sick virus kills somebody. Can somebody get that sickness from the dead? That's what we haven't heard about. What about ladies that usually have long add-on nails and other eyelashes? And what about covering of the head? What about handling supermarkets doors or business places doors? Should these people get somebody to open their doors, or how things supposed to work with that? Thank you.
Thank you, caller. Dr. Johnson?
Thank you very much for that question. I hope I get the different parts of the question. So the first part of the question about handling dead with coronavirus. You need to take, if somebody dies of coronavirus, then the number of protections would be needed in terms of avoiding any direct contact with that individual. As we said, to the best of our knowledge, how it is spread is either through this cough, sneezing, and cough or sneezing or contaminated surface. There is some discussion with regards to body fluids, and obviously a dead individual would have some body fluid. So the best means of prevention is to avoid any sort of direct contact with the dead individual, particularly if that individual dies of coronavirus. So for instance, in a funeral home, if you're going to bathe the individual, then you would expect it to be using gloves on your hands. You'll be expecting to be using face masks, and you'll be expected to be using something to protect yourself from the direct contact of or the liquid or the fluid or the water coming out from that dead body. So the main point here is to avoid any sort of direct contact with the dead individual, and to use whatever means of physical barrier there is, either through gloves, face mask, if you have to deal with preparing that dead individual. Dr. Hamid.
Just to add that, yes, we have the protocol for our time of Ebola virus and how to handle the dead. So as Dr. Johnson mentioned, it's the same precaution that we use um, to wear a PPE in order to not get contaminated or touch anything, including the dead body. We do know that that virus can survive in a dead body up to 48 hours. So it has to be managed properly and wearing proper personal protective gear.
All right. So another part of the question the caller asked was about the long fingernails, the ladies with long fingernails, and long eyelashes, because of course you mentioned that hand washing is key, but with the long fingernails, does that apply?
Well, the long fingernails, you need to ensure that you wash your hands properly and ensure that your nails are cleaned as well. Yeah, we know that these ladies have these very long fingernails, and they keep touching their faces, fixing the eyelashes. How you call it? This artificial eyelash they have on there, if it's falling off. So there's a tendency, that those ladies with these add-on, I really looking for the correct name. Of these eyelashes that they're putting on, if it's falling off. So at this time, probably it's advisable that you stay away from using this that side of eyelashes or artificial eyelashes if it encourages you to be fixing all the while. But if you're going to be touching it on a serious note, then it means that you have to be washing your hands or using the hand sanitizer. Hand sanitizer, which is an alcohol base, we encourage to use a hand sanitizer alcohol base of 70%. We are aware that hand sanitizer is running out. So soap and water, as we said, and washing your hand frequently and washing it for 20 minutes. So that's a very interesting question. Eyelashes, you'd be encouraged to touch your hands your eyelash very frequently. And with the long nails, you have to ensure that your hands are properly washed and your nails are clean. And avoid touching your eye and avoid touching your face.
Yeah, actually, in medical practice, by the infection control officer or a consultant, actually, who was here earlier last week, actually, and she suggested all long nails needs to be clipped. All long nails needs to be clipped. That's the truth. That's the truth. There is no way about going about it. If you want to protect yourself and properly clean, then needs to be clipped. This was actually directed towards some medical professionals, but it's the same principle for general population. Yeah. If you don't want to carry the virus back into your house, then your nail has to be short and clean. When you clean your finger, you have to rub it on your other hand. So with your long fingernail, you can do that procedure. So as a result, you will be harboring virus and other germs in your fingernails. So this is basically you defeat the purpose of any precaution that you are taking. So please.
Yes. So we'd endorse that. So it's a personal decision you have to make, but it's a decision which is in your best interest, in the interest of your health, in the interest of your family, to ensure that at least your nails are not getting contaminated and infecting yourself. So thank you very much. Yes.
All right, let's get back to the phone lines. Okay, we missed that caller. Let's get back to the phone lines. Of course, the number to call, 448-3284. Do we have a caller? Yes. Good morning, caller. Thanks for tuning in.
Hello, good morning.
Yes.
I have a list of questions. The first one is as it relates to the testing. I'm aware that random testing is not done, but the criteria for testing. I mean, that's to say, WHO has listed the case definitions for patients that you think you would test, right? But what if a patient comes in and the patient doesn't fit the clear-cut list that is put out by WHO? So, for example, the patient may not have a direct travel history from a hotspot with active COVID, or they may not have come in contact with someone that directly traveled, or they may have come in contact but they're not aware.
Okay, so I will start and Dr. Ahmed will continue. So we have a criteria for testing, and it's based on what WHO and CAFA in terms of who define as suspected or probable case. The question I'm hearing is what allowances are made for for exceptions to that. In terms of someone believes that he or she has the virus, has no travel history, is that part of our testing criteria? So we have in some instances not apply strictly the criteria used by WHO, but we are doing that in the initial phase by trying to establish whether or not the COVID virus is in fact in Dominica. So we have made up exceptions in terms of individuals who have not had a travel history, but because of the information and the investigation that we conducted, we will not get into specific as to the communities, etc. But we have gone ahead and used exceptions in terms of doing these testing. And what I can tell you, for now, the testing that we have done, even with the exceptions, the results are all negative. But Dr. Amir will speak in details in terms of what are the protocols that we have at the lab and the criteria for testing.
Yes, actually, Dr. Johnson explained the whole the criteria required to test. WHO do give a it's actually flexible now country to decide who should be tested. There is a clause, there is a option where WHO mentioned if patient is severe enough required hospitalization and presenting with atypical symptoms. So this boil down to, or this is actually come down to the decision of a clinician as to how he or she thinks that these patients exhibiting in terms of clinical symptoms. And on that basis, we can test without having travel history, without having contact with a confirmed or probable COVID case. So it exists now, and we had been testing on that scenario. As Dr. Johnson said, so far it is negative.
So just to add, so we are patients who are admitted on the ward with severe acute respiratory illness. I repeat, so patients who are admitted at Princess Margaret Hospital with severe acute respiratory illness, they're severe enough with something appearing to be flu-like symptoms and they have to be admitted. We also test them for COVID virus as well. They had no travel history, but part of the classification, the criteria, we test them, and the results are negative, as I said.
Okay, caller, if you're still on the line, we'll give you an opportunity to ask a couple more questions, but we'll be back on Friday with another discussion. So if you have a couple more burning questions, we want to give as many people an opportunity as possible. So if you have a couple more burning questions, we'll take them.
Yes. The last question is for Mr. Dr. Johnson, sorry, specifically. He mentioned that as it relates to the port of entry, something about high risk. If we have patients that are high risk or coming from high risk countries, what is the classification for high risk, medium risk, and low risk? And the next one is that he mentioned, as it relates to the port of entry, that there's a screening process that, well, the only thing he mentioned was there's a screening process, it's a temperature check or something like that, I heard, if I'm correct. And then he said there's a questionnaire by the port officers. So my question is, are there any health officials at the port of entry also conducting that type of assessment? And from what I gather is that the ports of entry, well, what I gather from what he's saying is that the ports of entry are still open. So what if a passenger is asymptomatic? Because in the initial discussion, he stated that there's an incubation period, and from what I understand is that the person can have the virus in the incubation period and transmit it before they start showing symptoms. So what if a person comes and they don't fit the criteria at all? So what happens in that case? I think this is one of the things that a lot of the people are asking questions about, because there are people that are asymptomatic coming in as it relates to the closing of the ports and that type of thing. So can I get some information as to that, please?
Okay, so I will, you direct the question to me, so I will start the discussion. So you asked what is high-risk countries. I mean, there are some countries that have what we consider to be full-blown community transmission of the COVID virus. there are some countries that have what you call imported cases. A lot of the countries in the Caribbean, in fact, all of the countries in the Caribbean that have COVID-19 virus, they don't have what we call full-blown community transmission. So WHO puts out that sort of classification in terms of countries that are hotspot countries with full-blown community transmission. We see them on the TV every day. We know that there are cases in the Caribbean, and so those are not hotspot countries. So these are not what really we consider to be high risk countries. In terms of the incubation period, we also apply a question. As I said, we get the health declaration from from whatever conveyance that it is, whether it's aircraft, and from there we ask, by applying the questionnaire that we have, a number of questions and determine whether that person is high risk or not, and then take it up from there. So Dr. Hamid will explain to you in terms of how do we proceed from there. Dr. Hamid.
Yes, I just want to say, yes, the high risk, as Dr. Johnson mentioned, is the country where there is sustained community transmission and not imported cases. So we look at that how many cases are coming from which are those areas in that country. Are those cluster of cases? If that is cluster of cases, even if it is local transmission, we do not consider as sustained local transmission. In order to fit criteria of sustained local transmission, it require the cases are coming from all parts of the country, and it is continuous. It hasn't stopped yet in last 24 hours at least. So in that sense, there are countries sustained local transmission we know internationally, but in regionally, so far we have two other countries which have local transmission at this time. Jamaica and Guyana has confirmed by WHO as local transmission, but we are still looking deep into it as to is there cases coming on daily basis or weekly basis. So on that basis, we will define again high risk countries or the list of high risk countries for our port health officer.
All right. Thank you so much for that insight. We're going to go to the phone lines, and caller, you are on the air.
Hello. In terms of the high-risk patients, I have a question about it. I would like to ask, what level of risk would you say Dominica is at with the virus due to the fact that our countries around us currently have numerous confirmed cases? So what level of risk would Dominica be at right now?
There is, okay, so let me just get back to the question of high risk again. So WHO has done a classification in terms of what is happening in the pandemic influenza. CAFA has also done, the Caribbean Public Health Agency has done a classification. Initially, before it became a pandemic, that was announced by the Director General of the World Health Organization on March 11th, that it is a pandemic, and therefore the Pan American Health Organization in fact reclassified the transmission generally in the region, general region, and most of the countries in the region. For the Caribbean region, it said that there's a high risk of transmission, or we getting the disease in the region. So Dominica, the risk of the disease getting into Dominica, particularly for importation, is high. Okay, so I wanted to make a distinction between countries that are high risk, or what we prefer to call as, according to WHO classification, countries that have no cases, countries that have. So the second scenario would be countries that have one or more cases that are locally detected sporadically. We have countries where you might have cluster of cases in certain geographic areas, and when you have full-blown transmission, community transmission, all over the country. That is one thing when we refer to the persons coming from these classification of countries. But in terms of risk of transmission of the disease in getting to Dominica, it is high. It is high, and I wanted to make that absolutely clear. So there's one thing to have countries that are classified high risk in terms of the where they are in terms of the disease transmission, and in terms of the other thing in terms of the disease getting to Dominica. High risk, Dominica is high risk in terms of the disease entering Dominica because of travel, and it is inevitable. We are preparing for the inevitable, but at the same time we have a plan. It's not a perfect plan, and the plan is a very flexible plan. It's a very fluid plan. We know that some countries are taking a certain aggressive decision, but the decision and the actions taken by Dominica, as I said, it is fluid and driven by the evidence. It is not perfect, and therefore it will change from day to day. So we have this plan today. It is implemented. The scenario changes tomorrow. A different decision will be taken as we go along.
All right. Thank you, caller. We have another caller on the line. Good morning.
Good morning. I wanted to know, can someone contract the virus and recover from it with no medical intervention?
The answer is yes. Dr. Amir is going to explain to you, but the answer is yes.
Yes, it depends on the immune system of the person. I mean, if you are well healthy and prime of your age, there is a report that many people did not require to go to hospital.
Okay.
They were actually asked to stay home, and then they recovered from that easily.
Okay.
There is no problem. There's lots of evidence on that.
So just to add, for instance, the evidence for the countries, as I said, how this is going to play out in the Caribbean and Dominica, we have to wait to see. But the evidence that we have so far is that 80% of the persons, or 81%, based on the science and the statistics that is done where you have this thing, is full-blown transmission. 80% of the persons who are infected, they are mild. So they hardly would need any medical intervention at all. You have another 15%, Dr. Hamid,
Yes.
that are severe, that will require medical intervention, hospitalization. And you have a 4%. So you have 81%, it is mild, there will hardly be at least that is what the evidence showing in the other countries. We cannot be absolutely sure how it's going to play out in Dominica and in the Caribbean. I want to make that very clear. And there's a 4%, okay, that will require intensive care management. So based on that scenario, our plan is also centered around that scenario. We know what Dominica population is like, and we have used the different modeling that is done in different countries to make a projection as to how many persons Dominica would be affected, how many persons are going to be severe, how many persons might require intensive care management. But as I said, we do not know for sure how it will play out. And the plan will change based on how it actually plays out in Dominica. This is new. I mean, it is new. It's a new virus. It has a new behavior, and there's a lot that is not known about the virus so far.
I just want to add to that point is that to remember good nutrition, adequate water, and proper rest will help long way. So just to keep in your mind.
All right. Thank you so much. Let's get back to the phone lines. Caller, good morning. Afternoon, rather.
Afternoon. Hi. I'm trying to get into the live line with a question.
This is the live line. Go ahead and ask your question.
Okay, so I have known of a few people coming. We have ways of testing within the country, but what about at our ports? I mean, I know of people who've come in and nobody has asked them where they've been from. Some of them have come in from compromised areas. What are we doing in terms of that?
Okay, like in any system, the system is not perfect. Is that perfect? What is done at the port is a collaboration between the immigration, the port of entry, customs, and the Ministry of Health. So there are going to be a few cracks in the system or gaps in the system. I know that the ministry, particularly the immigration officers, are probing individuals in terms of where they're coming from. You have to fill out a form, the ED form, the immigration form, and one of the requirements of the immigration form, you have to declare where you have been for the last 6 weeks. We know that some individuals will not be telling the true story. Okay, they will probably lie to the immigration officer, and that would be unfortunate. But as I said, it's not a perfect system. There is collaboration between the Ministry of Health, the Port Health officers. There's also collaboration between customs and one other agency we forgot to mention in terms of the Dominica Air and Seaport Authority collaboration. So we're working collaboratively to capture as much information as possible, but we're dealing with we're dealing with human nature. Persons will not speak the truth at all times, and it is unfortunate, and we love you to be able to protect yourself and to protect this country, to give us all of the information that is required, as I said, to protect you and to protect your family and to the rest of the citizens.
All right, Dr. Ahmed, can you expound on that just a little bit? Because we spoke earlier, Dr. Johnson, about the medical declaration of health that comes in beforehand. We also are aware that the immigration department has a system where they get travel information about the travel history of passengers. So, Dr. Ahmed, can you expound on that a little bit too?
Okay, thank you. We do have maritime declaration form. This is specific to those who are ill or sick in a plane or in a cruise ship. Other than that, we do have a mechanism called advance information.
Passenger information.
Right.
Advanced passenger information.
Advanced passenger information, API.
Mm-hmm.
We do receive that data way before the plane arrives in our port. So with that, we also monitor who are those people coming, and then we alert our port health officer. We also alert our immigration officer, and we also alert our primary health care. So we are maintaining it. We are doing it since January, and we will continue in all ports of entries so far. So this is exist, and as Dr. Johnson mentioned, there will be some gaps in terms of catching each and every one of them. They may lie, they may just sneak, not saying the proper or giving us the proper information. As a result, we may not see. But from now onward, as I want to add to it, is that we are screening all passengers, regardless hotspot or not hotspot countries, and we hope to implement in all ports of entries, from going forward.
Before we get back to the phone lines very quickly, we mentioned the airlines, we mentioned cruise ships, ferries. What about the yachties that are coming in? What system is in place for them as far as, reporting and recording, their travel history?
Okay, so the yachting is interesting that you asked that question, because it was discussed at length in an extended IHR steering committee meeting. We realize that we have to tighten up on the persons that are coming through the yachting. Just to say that most of us know in Dominica that in terms of what is happening at the ferry, it's understanding that the ferries have been cancelled. A number of cruise ships have been cancelled. We recognize that the yachting community is a community that we have to be paying closer attention to. In fact, one of the things that we have done in terms of, even through the health promotion unit, is that we have met with it was in Portsmouth last week, the individuals that are directly involved with the yachters in terms of going to get them and to bring them in on shores. So it's a system where we're trying to improve on. We have seen some statistics in terms of increased yachts that's coming in. We are working to ensure that we get the medical declaration of health from these yachters as well. So I repeat, we're working to ensure that we get a medical declaration of health from the yachters, and to ensure that we tighten up on the yachting community. The yachting community is something that is not only, I would say, particular challenge for Dominica, but it's a challenge within the region. We recognize how porous it is, and what I would say for now is that a number of steps are being taken to ensure that we can capture the yachters, we can get the information in a timely manner from yachters, working collaboratively with immigrations, with custom, the Dominica Air and Seaport. So from the yachters, the individuals are not going directly into the community without a proper screening and detecting process. One of the things that we'll be doing is to ensure that anyone coming from the yachters, they will get that information beforehand, do a screening process of them, and determine, in fact, whether or not they could come in the community. So something that we're tighten up on, and we are very happy for that question.
All right. Thank you very much, Dr. Johnson. Just to reiterate one of the points that Dr. Johnson made, honesty is key here because, people may lie during the interview process, but we want everyone to know that it's to your own detriment. And if you love
Exactly.
your friends, family, you don't want to be dishonest. And then not just with COVID, but with any
Anything.
virus, you're dishonest and you carry that virus to your home, to your grandmother who is vulnerable, who might be diabetic or hypertensive. So it is in your best interest, in the best interest of your family and friends, to be honest when you are asked about your travel history or your symptoms, or if you've experienced or been in contact with anyone who has been tested or positive.
Well, I'm happy you made that statement because, as I said in my initial remark, this is not a Ministry of Health thing. It is everybody that is involved in it. Okay, and we have to be honest. It's an all of society approach because the Ministry of Health is just one institution. We have our doctors, and I really want to take this opportunity in terms of commending our nurses, our frontline workers, who. And one of the things that we have told them is that we have to behave now as if, although we have no known case of COVID virus in Dominica, but we understand that this thing can show up at any time. We have activated our plans within our health districts. We have activated a plan at the Princess Markdale, and all other major departments within the Ministry of Health have developed their plan. As I said, it's a fluid plan with a plan is not built in stone, and as this thing unfolds, then we activate in certain elements of the plan. But I want to take the opportunity to thank our healthcare workers, who I know is under tremendous strain. The call to duty, we have a responsibility as healthcare providers to care for the sick persons. To care for sick persons, to care for persons within our community, within our community. We know there's a lot of anxiety within the general population. Am I going to get sick? Is this thing here? Am I going to die if I get it? But it takes a community approach to address it. We all have to play a part. It cannot be left just to one sector or one set of individuals to do this. And as I said, I was happy to hear that the different institutions, organizations are actually developing their own plans. We have to treat it as like it's going to be a national disaster. And in terms of a national disaster, all sectors, the individual going right up, have to have a plan to address it.
All right. Thank you very much, Dr. Johnson. Let's go back to the phone lines. Good morning, caller. Afternoon, caller.
Good day. Quick question. How does Dominica's stance differ from that of Grenada? Our sister island suspended schools for a period of time, injected $2 million into the health sector, and imposed travel restrictions to numerous countries. However, this was done even though the country doesn't have any confirmed cases of the virus. Do the panelists think that Dominica should follow suit with such aggressive preparation?
Well, different countries take different positions on certain issues. They are, as we said initially, what we do, we try as best as possible for it to be guided by science. So Dominica, what I would say to that, is that Dominica's position is not dictated by what other countries necessarily do. That is the most I would love to say on this at this moment. So what Dominica does, every country does what you call its own internal risk assessment. So there are broad guidelines that are set out there by the WHO that is guided by science. And I do not want to get into the discussion as to what this country do and what Dominica is doing.
I just want to echo with Dr. Johnson. Yes, it depends on the country's situation. Everyone do their own risk assessment, and as I mentioned, our stand on those issues are not always the same. As the time progresses, we will be assessing as the time goes, and depends on the risk. There will be more decision on that level. So I can just add to that much.
All right, thank you so much. Let's go to the overseas line. Caller, good day. All right, we lost that caller. And let's take the next caller. Good afternoon. Thanks for joining us.
Hello.
Yes, go ahead, caller.
Good afternoon.
Yes, I am just listening to the program. It sounds very interesting, and we have to begin somewhere. And I think I am beginning at the beginning, the early childhood center. We have to educate the children the ways in which they have to wash their hands.
Exactly.
The different ways they have to cough and so we are starting. I mean, I have started at Charlotte Nursery. I know sometimes people look at it as a big, something big, but if you have the patience, you have the commitment, you can be the guidelines for this group. So we are trying something. We have the washing of the hands, we have the sanitizing, the teach them a little bit about COVID-19, what we know in our own little way. So I'm very happy. I'm listening at school now, and I'm listening to the program, and I know that it's going to be of a great help to all of us. Thank you.
That's great. That's great. One of the things I love of what she said is what she's doing with the children, because we have to change habits, and I'm interested in the meeting. We have to start at our homes. Teach our children how to wash their hands. Look, your hands dirty. Why are you touching your face? Go and wash your hands. There's a hand sanitizer there. You just coughed in your hand. I told you, do not cough in your hands. Okay? Go to the bathroom, wash your hands. So we start at home, we start in the school, and then it goes on. Thank you very much.
I just want to add to it the change of habit. Change of habit is so important. It doesn't necessarily just for COVID virus. This had been on the media for last 10 years or more. So anytime we have flu seasons and we try to give you the same education that we need to do hand washing, do the respiratory etiquette. Just to tell you, the flu virus kills more than what is now coronavirus doing in 3 months. In beginning of January, just January month alone, 10,000 people died of flu virus in the United States. And that's more than what coronavirus did in 3 months. So just to say, we need to change our habit, not only for coronavirus, beyond. So it will help for coronavirus and many more germs that are out there. So we need to start changing our habit in terms of washing and respiratory etiquette.
You have someone is on the line?
Yes, we have a caller from overseas. Good afternoon, caller.
Good afternoon, ma'am. How are you?
Oh, thank you. Thank you.
And good afternoon to your guests. Dr. Johnson and Dr. Ahmad, thank you for what you're doing. I think it is very important in light of this threat of coronavirus. In reference to the screening at the port, I think some people are confused with what a screening actually is. I think some people expect when they come in to the country, they should get a test, right?
Test?
And like a COVID test.
Oh, okay.
From what I've been hearing, from on the public. So, and like you said, a screening, could be a questionnaire. It could be, a temperature. It also could be the information format you fold in, or a combo of all. Okay, so that is why. And the caller called earlier and said that somebody could come in showing no signs of the virus, but actually having the virus because it has not shown up in the system yet, since it has a 14-day incubation period. So that is why it is so vitally important that we, the citizens of Dominica or the Caribbean of the world, be so vigilant and be very responsible that if we have any signs, we call the hotline and we quarantine ourselves, right? That is why it is so vitally important that we, the citizens of Dominica, follow the protocols of practicing good hygiene, that we can protect ourselves and protect our fellow citizens. And I think what you're doing today is a very important step, because there's a lot of confusion going on in Dominica. We have people who seem to know everything, but don't listen to the experts. Thank you very much. Have a wonderful day.
Thank you, caller.
Thank you, caller. I just got a WhatsApp message there that someone wants us to speak about. Interested in the use of medication, and just this morning, and there's a lot of discussion now with regards to what is used for treating the COVID virus. Obviously, we said there's no vaccine, there's no for treating coronavirus. But one of the things that the science has been looking at is that the idea of the effects of ibuprofen. In fact, there's a scientific article that's been put out there in terms of discouraging the use of the ibuprofen. The WHO has not completely sanctioned the non-use of ibuprofen. So this is a text message that I got from an individual. I did see the article. It's a scientific journal. What I would say is that before using any medication, ibuprofen, it's best to see your healthcare provider. In the abundance of doubt, do not go and use any what we call non-steroid anti-inflammatory medication like ibuprofen, naproxen, or even it comes in Advil. If you suspect that you have, for instance, the flu, or you might be suffering from coronavirus, it's better to use paracetamol for the fever and for the pain. But we'll hate persons to think that they have coronavirus and be self-treating themselves at home. At this stage, we're not encouraging that. We would like to know and like you to report to your healthcare provider if you think that you might be exposed or suffering from the COVID virus. And in doing so, we encourage to call. Obviously, we're not saying if you're calling and you cannot get through that you should not seek medical attention. We don't want persons to stay at their home and get sick, and certainly our elderlies or to die from this. We encourage persons when they go to the healthcare setting. That's the only time we encourage to use, if someone is sick, to use a face mask. So if you have some sort of flu and cough and you're fever, you're seeking medical attention, we advise you could use a face mask when you're going to seek medical attention, whether it's in a private doctor, to the health center, or the hospital, or at any one of our health centers for the island. And if you're sick at home and someone is taking care of you and you're suffering from this fever, flu, cough, we encourage you to use the mask so that you don't affect any other individuals in your household as well.
All right, thank you, Dr. Johnson. We know that the public, you have a lot of questions. We'll be back on Friday at 11 o'clock if you don't get through today. And we're getting very close to the end of today's program. We'll take one final caller. Good afternoon, caller.
Good afternoon. Dr. Johnson, what would you advise people who board buses if they should use their mask? And people who go to supermarkets and order private health places, how they should handle this door, if they should travel with the glove, or if the institution is supposed to have somebody to open and close the door, how we should deal with those things?
Okay, so I think I heard part of the question in terms of traveling on buses, whether you should be, how should persons travel on buses?
Wearing your mask.
Okay, so we first of all, we don't encourage the use of masks for persons who are healthy. Okay, number one. If we have not said it before, but we like to say it now, that you have to avoid anyone who is coughing or sneezing around you. So in the bus that we have, we know that persons could be sitting very close to one another. So clearly, if you're traveling on a bus, let's say to get to the hospital, we'd encourage those individuals to use a mask. If you're coughing coughing, if you're sneezing, you're sick on a bus, you should use a mask to avoid contaminating an individual. The best thing is if when you notice someone who is coughing and sneezing on the bus that they're not using a mask, or then you should avoid being on that bus. I mean, that's the best advice I could give. So you notice that a number of individuals who are or an individual who is on a bus and you're close to the individual that's coughing and sneezing, the person is not using any sort of protection in terms of barrier or mask or on his or herself face, then you should probably remove yourself from that bus. That's the best advice I could give. Handling doorknobs, we spoke about ensuring that you use hand sanitizer. If you're going to use a paper towel, a tissue to open the door, then you have to ensure that there's a way of disposing of that tissue. Don't put it in your pocket or in your handbag or in your purse after you open it. You should try to dispose of it. So we would encourage even the business places to have some sort of a bin where persons can dispose of these tissue. Okay, so after you open the door, wash it. Well, if you're in a business place, maybe there's not a pipe close by, but ensure that you sanitize your hands after. Okay? Use some sort of hand sanitizer, sanitize your hand. And if you use a tissue to open the door knob, then throw it away immediately. Not in the street, but dispose of it in some sort of garbage bin.
All right. Thank you very much, Dr. Johnson. And we are all out of time for today's program. Final remarks. Let's start with you, Dr. Ahmed.
I just want to say, if you are sick, then do not leave the house. If you are sick, please stay home until you get better. So it will be helpful for you and others. Another last point is that we do not have coronavirus. We have tested and they are all negative. So to say that there is no coronavirus in Dominica.
Okay, well, it's a pleasure being here. I'm excited when the public asks questions because we're able to answer the questions of the general public. I know persons are concerned, legitimately so. I personally don't like the word pandemic because it seems that persons are panicking. Even if we tell people don't panic, but obviously the fear of the unknown is what persons are panicking about. It's all of government, all of society, all of us are involved in this together. It is not a Ministry of Health thing. It's not a government thing. It's not a health sector thing. It's not an immigration thing. It's all of us have to play our part in fighting this virus. We have to pray, obviously, and we are planning for the worst but hoping for the best, but we know that the inevitable will be here. And I'm an optimist at heart. I personally believe that we are very resilient. We have been fighting very hard. We're putting plans in place, and I think it will affect us. The extent to which it affects us, I don't know. But I think as Dominicans collectively, we can do a lot to minimize the impact it will have on all of us in Dominica. So I'm really happy to be here, and I really welcome coming back to the studio at any time to answer the questions from the general public and sharing with you what we know and let you know what we don't know, because we do not have all of the answers.
All right, so our special thanks to Dr. Ahmed and Dr. Johnson for joining us on today's program. Like I said, we will be back with you on Friday morning from 11 o'clock for another edition of the COVID-19 health program. We want to thank our callers and thanks to all the listeners for joining us on DBS and on Kyrie FM, and of course on the YouTube page of the Office of the Prime Minister. Thank you again, and tune in for another edition Friday morning.